Dr. Sarah Lynn Marks. She was the White House senior policy advisor during the Ebola crisis, and she's worked for 4 administrations, and she was also the senior medical advisor to NASA for nearly 2 decades. She's the author of the book Stellar Medicine. And Doctor, you actually start your book with a chapter about pandemics and misinformation, and you had today the WHO saying that finally they're declaring it a pandemic. So what does that mean to you? What should we know?
Well, Dana, I think we were all waiting for that official designation, and I think governments all around the world were already acting as if there had been a designation, trying to scale up the public health infrastructure and their surveillance programs. I think what it allows us to do is first put that clarion call to every government around the globe that they need to begin or to accent what they've been doing. Furthermore, I think it also helps to coordinate, and it also provides resources. You know, there's sometimes pushback about giving a designation because words have power, and we don't want to frighten the public, and you don't want to have any more financial disarray that there is. But I think it's important that we're all on the same page and that we're all working together.
What do you say about this? We don't know. Everything we know about this virus seems to change a little bit every day. In some people, it's very mild. For some people, it could be very severe. We just heard about the man in New Rochelle who, at the epicenter of the virus up there, the outbreak, he's in a coma. But some people, they might have symptoms but not get too severe. And some are comparing it just like the regular old flu that you could get in a year. How do you explain it to people?
Well, Dana, the interesting thing here is we're seeing the presentation very differently in different age groups and across different populations. So, for example, children may have very mild symptoms, not even know that they have it, whereas those who are older, and again, how do we define older? Generally, it's over 60, but we do see the highest morbidity and mortality rates over the age of 80. And we also see severe symptoms in those who have pre-existing conditions, such as diabetes, heart disease, or immunocompromise from either chemotherapy or other conditions. We are trying to understand how this virus interacts with our immune system. It may be perhaps that children just have pristine lungs, that they're able to handle any invader, and on top of that, they're able to regulate their immune reaction. Whereas older individuals may mount very robust responses, and it's actually their own immune systems that begin to attack their lung tissue, and we call that cytokine storm. Again, it's a new virus. We're learning every moment, every day, and hopefully that will help us as we need to find ways to treat it.
If you look at the uptick in cases in China and South Korea, just for 2 examples, they took some very aggressive measures early, maybe not early enough, but early on, and their cases have started to come down. We have now just topped over 1,000 cases in the United States. We've seen what's happening in Italy. Where do you think we are right now, and what more aggressiveness do we need in order to get our case numbers to start coming down too?
Well, as we saw in China, they implemented a really strict quarantine and they enforced it. I think it's easier to do in authoritarian societies. I think it's a little harder to do in America, where we're used to our freedoms. We do know that social distancing does help, and that is what we're going to start to see more of. It's beginning right now with the closure of different schools and conferences. And what we need to do is try to slow down the spread. One of the issues that we're quite concerned about is what we call surge capacity. Do our medical systems, our hospitals, do they have the capacity to be able to handle what is here and what may be coming?
So if you are a person that has symptoms and you don't want to overwhelm the medical facilities, should you go to the doctor?
Well, if you have symptoms, it's really important to contact your physician. I think different clinics and different hospitals and medical facilities around the country are going to have different programs. If you need medical assistance, you definitely need to go, but you should call ahead so they can prepare for you.
I see.
Several hospital systems across the country are creating satellite sites so they can triage and screen you in an appropriate manner.
All right, Dr. Mark, thank you so much. We appreciate your credibility, your voice, and then your experience. We appreciate it.